One second.
Good afternoon, colleagues, faculty, and students. On behalf of Symbiosis Center of Healthcare, HCHC, I, Dr. Rohini Kuru, Deputy Medical Superintendent, HCHC, welcome you all. Today's session is part of the Health Promotive Initiative for TB Mukta Bharat, supporting the Government of India's TB-free 100-day campaign. Tuberculosis remains a critical public health challenge. However, through targeted awareness, early clinical diagnosis, adherence to treatment, and robust community action, eliminating tuberculosis is entirely achievable. Before we proceed further, let us anchor our session with institutional guidance. I invite you all to listen to an opening message from our Director HCHC, Dr. Alka Chanda.
Namaste, CPM. A cough lasting more than 2 weeks should never be. It could be tuberculosis or TB. The good news is that the TB is preventable and completely curable with early diagnosis and proper treatment. Know the symptoms, get tested early, complete the full treatment, support people affected by TB, never stigmatize them. Every student can become an ambassador of awareness. Let's work together for a healthy campus, healthy community, and TB-free India. TB hareगा, देश जीतेगा. Thank you.
Thank you, Dr. Alka, for setting the vision for today's initiative. Moving forward into our schedule, please scan the QR code on your screen. This brief baseline assessment allows us to gauge existing clinical awareness. We will pause for 5 minutes for you to complete it. It is now my privilege to introduce our speaker, Dr. Sarang Kulkarni. Dr. Kulkarni is an MBBS gold medalist and university topper in medicine, with advanced postgraduate training and fellowships from CMRI Kolkata and Apollo Hospitals, New Delhi. His extensive credentials include specialized certification in pulmonary medicine, diabetology, and mechanical ventilation. Currently, he serves as a consultant with HCHC and leading tertiary hospitals in Pune. Given his profound experience, he will guide us through the pathogenesis, prevention, diagnosis, and management of tuberculosis. Dr. Kulkarni, the floor is yours.
Thank you so much, Dr. Rohini. So let's start with the session today, and we are going to speak about TB Mukta Bharat, that is TB Free India. Uh, and we'll start with the presentation. Please start the presentation. Okay, so why are we talking about TB? So let's understand tuberculosis basically is a bacterial infection which is caused by Mycobacterium tuberculosis. That is a bacteria which causes this infection, particular infection. Now, it is one of the most elderly disease or eldest diseases known to human being. It is spread by droplet method or airway, and it is perfectly preventable and 100% curable. So we are working towards a TB Mukt Bharat. That has been our goal since a very, very long time. But the new government or the government currently which is there in the power has introduced a TB Mukt Bharat Abhiyan. In that Abhiyan, we are doing this as an awareness session for TB, tuberculosis or TB. Now, it is very important to recognize what is TB, what are the symptoms of TB, what we can do to make an early diagnosis, and if we do early diagnosis of that patient, then we can save life of that patient. That's why it is really important to know how to know what is TB and how to diagnose it. So every individual in Symbiosis, outside Symbiosis, anyone who you know and everyone who is living in India can be the ambassador of TB Mukt Bharat. So we can work towards a healthier society and every individual can contribute. In that sense, only TB will be defeated and India will win. That is TB harega, desh jeetega. Next, please. So let's understand what is TB first. As I told you, TB is an infectious disease which is caused by bacteria. Bacteria is one of the small particles which causes infection in human beings. So the name of that particular bacteria is Mycobacterium tuberculosis. It spreads through air, via cough, via sneeze, or even while speaking. So whenever a person is opening their mouth and the saliva comes out by any method, any means, it can be a carrier for TB transmission. So TB basically is a disease of lungs. In tuberculosis, there are particularly two types of tuberculosis infection. First, we call as pulmonary or lung tuberculosis. In Latin language, pulmona means lungs. And in that sense, it is called as pulmonary tuberculosis. And whatever is not lung tuberculosis is called as extrapulmonary tuberculosis. So it can involve lymph nodes, it can involve bones, it can even involve brain, kidneys, any organ, tissue, or cell in our body can be affected by tuberculosis. So we have to maintain or we have to keep that in our mind that TB is not only chest infection, it can be infection of different organs, tissues, or cells of our body. But most common is lungs. So pulmonary tuberculosis constitutes around 60% of TB burden and around 40% or 10 to 40% tuberculosis only is extrapulmonary tuberculosis. That's why we have to be very careful when we are coughing, when we are sneezing, or whenever even speaking, that we are taking proper precautions. In COVID, we understood or we learned what is taking precautions about cough, what is taking precautions about sneezing and speaking. So wearing a mask whenever you have infection or whenever you are symptomatic is really important, and that lies true for all the diseases. Next, please. So how does TB spread? It basically spreads through air. So whatever droplets are coming out of our mouth, they float in air and they reach the next person, whoever is next to that particular patient. So air is the main transmission vector or main transmission carrier. Then prolonged close contact means if a person or a patient is TB positive and a healthcare worker or a family member, colleague, or a friend is in close contact of that patient, then they can also have tuberculosis. Crowded, poorly ventilated spaces are the risk factor of TB spread because there is a air saturation and droplets get saturated in that particular non-ventilator or poorly ventilated spaces, and they can lead to higher risk of TB infection. Now, there are some myths that how TB can spread, and we have to break those myths today. So, sharing food, handshakes, touching objects do not spread TB. So, sharing food, what does it mean? If you take food from or if you share food with a tuberculosis patient, it will not give you tuberculosis. Shaking hand or a casual contact with that tuberculosis patient does not transmit tuberculosis. So, you have to maintain or you have to understand the fact that only air droplet method is the method of transmission of tuberculosis. Also, I told you that 40% can be extrapulmonary TB. But first exposure to the body by of tuberculosis bacteria is by droplet method. So you have to understand that the entry of the Mycobacterium tuberculosis infection in the body is only due to air or droplet method, not by touching objects, or even if a person is wearing some clothes and they are TB positive, or if you share their linen, that also does not spread any TB infection. Next, please. So, what are the symptoms of tuberculosis? First of all, understand that understanding symptoms is the mainstay of recognizing a TB case. So, person can have fever. Now, fever can be caused by hundreds and hundreds of diseases, but you have to understand the fact that prolonged fever is a sign of tuberculosis. The person also can get night sweats, they can get drenched by sweat in night. That is also one of the pathognomonic sign of fever of tuberculosis. Now, cough, which lasts more than 2 weeks, is a very important sign and symptom of tuberculosis. Also, if there is a blood in sputum, because a person is coughing for a while, for 2 weeks they are coughing, so there is bound to be endothelial or blood vessel injury to that person, so they will bring out the blood in sputum. Now, blood in sputum is not only specific for tuberculosis, it is more specific for cancers or other dangerous diseases. But yes, it can be present in tuberculosis as well. So, if somebody is bringing out blood in their sputum, it is a cause to show to a doctor or consult a doctor regarding the same. If a person is having loss of appetite or unexplained sudden weight loss, now, how do we define weight loss in this case? Around 5% of body weight is lost in 1 month or less than 1 month is called as sudden weight loss or sudden significant weight loss. Now, if person is having fatigue, lethargy, also one of the reasons can be that you are studying too hard or you are exercising too hard. But unexplained fatigue is also one of the signs of tuberculosis. So keep this in your mind. 2 weeks of fever, 2 weeks of cough, blood in sputum, unexplained weight loss can be tuberculosis. If these symptoms persist, then please seek medical advice. And if you see somebody who's having these symptoms, then please advise them to get tested for tuberculosis. That's how you can become an ambassador of TB Mukta Bharat. Next, please. Now, who is at higher risk? Let's go one by one. The person who has weakened immunity. Now, there are hundreds of reasons to have weakened immunity. I'll give you some to you. I'll give you some examples to you regarding those. First, it can be HIV infection. HIV infection gives rise to reduced immunity because there are white cell count in those patient goes down. Cancer patients, the patients who are receiving chemotherapy for cancer, autoimmune diseases patient who are receiving autoimmune means immunotherapy for the autoimmune diseases also can have weakened immunity. Now, there can be a higher risk in diabetic patient as well. Why does that happen? Because there is a endothelial injury or blood vessel injury. Whenever there is a blood vessel injury, it gives rise to lesser blood supply, which leads to improper exchange of nutrients, oxygen and carbon dioxide along with removal of bacteria. So that's why any disease which can cause vessel problems can lead to higher risk of tuberculosis. Then malnutrition. It again leads to weakened immunity because less amount of protein is taken and less amount of immunity is built up in those cases. Tobacco use or alcohol use. It is very important to know that tobacco or alcohol both can cause endothelial injury, that is blood vessel injury, and subsequently it causes lesser blood supply in that individual, leading to higher risk of tuberculosis. And again, close contact with TB patients. The patients who are known to have TB, their family members, their friends, their colleagues, healthcare workers who are treating those TB patients are always at higher risk of contracting TB. So it is necessary for anybody who is taking care of tuberculosis patient to get tested for tuberculosis as the disease is progressing, to know whether you yourself have contracted tuberculosis or not. Next, please. So as I told you in the earlier slides, TB can be 100% prevented and it can be 100% cured. So understand that fact that whatever God or whatever the Almighty has given to us, it can never be 100% regenerated, even by the body. And we doctors can help you, but never can achieve 100% recovery from any infection. But yes, it can be cured totally from the body. That means the burden of tuberculosis bacteria will be taken away from your body and you will be cured of the bacteria per se. But whatever damage it has caused, it might remain in 1-2%, or if it is long lasting, it can remain in higher percentage as well. So how it can be prevented? Let's see one by one. First of all, whatever we learned in COVID, you have to keep that in mind all the time, always, and you have to keep uh, alerting everybody regarding the same also. So cover your mouth while coughing, while sneezing. There is a way of vampire cough also, where you put your forearm in front of you or your arm in front of you whenever you are coughing or sneezing. That prevents the bacteria from passing in the air, or air droplet method gets prevented. Ensure that your work area or your home is properly ventilated. It should not be saturated. Whenever a person is coughing, sneezing, or speaking, it can get saturated with bacteria and with viruses. So, ensuring good ventilation is a way of preventing those saturations. So, maintain good nutrition. It can give rise to good immunity, build up of immunity, and antigen antibodies on white blood cells in your body. So, good nutrition is always a way to go. Seek early medical advice. If you have the symptoms which I have already enumerated, such as fever, unexplained cough more than 2 weeks, blood in sputum, unexplained weight loss, and fatigue, which is also unexplained or there is no reason for it, then please seek early medical advice. You can have tuberculosis, or if you notice somebody who is having these symptoms, ask them to seek medical advice. It is always better to prevent tuberculosis than to treat it later on. And complete the treatment if you are diagnosed with tuberculosis. I can't stress this fact enough that the TB burden in India is rising because the person or the TB infection patient does not complete the proper treatment. That's why reinfection and relapse are coming again and again. The treatment for TB infection is long lasting. It lasts almost 6 to 9 months. So it is very easy for patient not to adhere to it. So they need encouragement, they need support, and always ask them whether they are completing the treatment, they are adhering to the regimen. If they are not, encourage them to adhere to the regimen, so the person will get 100% cured. If you or if any person leaves the treatment in between or midway, there is a chance of getting drug resistant TB or incomplete cure of tuberculosis, and then it can relapse or there can be reinfection of tuberculosis. Next, please. I already told you TB is curable. The TB infection can be 100% gone from your body with treatment. The treatment for pulmonary tuberculosis is for 6 months, and for extrapulmonary, that is TB of anything other than chest, is of 9 months. The TB treatment is available for free in government programs. You can go to any government hospital and get TB treatment for free in at any point of time, and they are bound to help you as it is made free from the government. So make sure that you uh, take treatment early. So if treatment is started early, the complications do not rise, and we can prevent those complications from happening. Now, stopping medicines in midway can be very dangerous. I have already told you the Mycobacterium tuberculosis persists in body for a very long time, and it takes a longer treatment for it to go away or to get uh, what you say eliminated from the body. So it has to be a long time treatment. Do not stop the medicines in between. It can lead to drug resistant tuberculosis. Why it is becoming harder and harder for doctors to treat TB, or why the government has to come up with new plans to treat TB, is this is the very reason for it, that people who have, or patients who have tuberculosis, usually tend to stop the treatment in midway when they feel that I'm cured of it or I do not have any symptoms anymore. They stop the medicines, and it can lead to drug resistant TB. What does that mean? What does drug resistant TB mean? It means that whatever treatment is basically in guidelines, whatever is the first treatment given to the patient, the bacteria becomes resistant to that particular treatment. So we have to give another treatment to that particular person, and there are chances that the bacterium can become extremely drug resistant, that is XDR or PDR, that is pan drug resistant TB. In that condition, any medicine which we give does not make any difference to the patient. So stopping midway is very dangerous. Again, complete the treatment, complete the whole course of the treatment. It is mandatory, it is essential to be totally cured from tuberculosis. Next, please. Now let's see some myths, and let's break those myths. So first myth which we want to address is TB is incurable. I have already told you that TB is curable and can be eliminated from the body. Next is TB spreads through food. It does not. I have already told you, handshakes, close contacts, sharing food, sharing bed linen, clothes does not transmit tuberculosis. It spreads only through air by droplet method. Next myth is tuberculosis patients should be isolated completely. Now the treatment is going to last for 6 to 9 months. As humans are social animal, we cannot be isolated from people for 6 to 9 months. We have seen what are the effects of isolation during COVID time. So patient needs continuous support, they need treatment, and for that fact, they have to be isolated for only time when they are contagious. Once the symptoms go down and their sputum smear comes negative, they can go around in their campuses. If they are in college, if they are in hostel, they can go about their normal routine, and they need proper support to get to adhere to the regimen of 6 to 9 months. Next myth is TB is a disease of only poor. Anybody can contract tuberculosis, as TB is endemic to India. Around 1/4 of every case in world of tuberculosis is in India. So around 25 to 26% of global burden is only in India for tuberculosis. So TB is not the disease of only poor, but yes, there is a higher risk of poor people or poverty people in poverty to contract TB because of poor ventilation and crowded spaces. But anybody can contract TB. TB does not need to be only airway TB or lung TB. It can be TB of other tissues as well. Next, please. Now, usually there are some diseases which come along with stigma. For example, HIV, for example, mental diseases, for example, depression, for example, cancer, and also, for example, tuberculosis. There lies usually a stigma for tuberculosis patients, but that stigma hurts. It does not support, it usually discriminates. So we have to achieve the goal of TB Mukt Bharat. In that case, we have to support and not discriminate. So understand that TB patient deserve dignity and respect, avoid stigma and giving misinformation. If you do not have proper information, seek advice. You can consult with HCSC doctors. They can give you proper information regarding tuberculosis. How does it spread? How can we take care of ourselves, and how we can prevent it? Encourage testing and treatment. I have already told you the fact that early testing or early diagnosis leads to prevention of complications. Treatment in timely manner is really important to avoid the emergence of drug resistant TB. Family and community support is really important. If a person does not have stigma regarding particular disease, they are likely to adhere to the regimen as it is long lasting. If there is a support, and if a person keeps asking them whether they have taken the treatment or not, and if there is a person to inquire about it, it is highly likely that they will stick to that regimen and complete the TB treatment, so they can have 100% or full recovery. Next, please. Then, as Symbian or as a ambassador of TB Mukt Bharat or TB Free India, what can be your role of in this campaign? So first, you have to take the Nikshay pledge. Now, Kshay is the name of TB or tuberculosis in Sanskrit or Hindi language. So Nikshay means TB Mukt. So you have to take that pledge. Then second step which we can do is spread awareness. Whatever I am telling you, you can go and tell that to your friends. You can spread this around in your family. You can spread this around in your society or any place where you frequently visit. So what does that, or what will that do? That will create awareness. If anyone who has these kind of symptoms can come to healthcare system, and if they do have tuberculosis, then they can get diagnosed. And even if one person gets diagnosed because of our TB Mukt Abhiyan, or due to your role in this Abhiyan, then this is worthwhile doing. Next step which we can do is we can encourage early testing. What do we mean by that? If anybody has these symptoms, fever, night sweats, cough of more than 2 weeks, fatigue, unexplained weight loss, encourage them to get tested. The testing is also free in government institutes or government hospitals. Usually, we tend to tell them to do a sputum test. There are two sputum tests which you are encouraged to do. One has to be a morning sputum test. The next can be morning or spot sputum test. If that also comes negative, then we tend to tell them to do a chest X-ray. Now, this is early testing. This is only for screening. In this screening, if a person gets tested positive for tuberculosis, then we can tell them to get treated, and that's how you can play your role in TB Free India. Now, the next step which you can take is promote treatment completion. I have already told you, if you support the particular person who has TB, it is likely that they will adhere to the treatment as it is long lasting, and they can complete the treatment and can get 100% cured of tuberculosis. Also, always support people affected by TB, avoid stigma, avoid misinformation. If you support those cases, or if you support those patients, it is likely that we can achieve this TB Mukt Bharat Abhiyan, or goal of being TB Free India. Next, please. As HCSC, what do we do if you have these symptoms? So HCSC is present in all the campuses. So if you do have these symptoms which I've already enumerated, you contact HCSC immediately. If you do have any problem like fever, cough, or unexplained weight loss, you can come to our doctors. Our doctor can recommend you to get tested. If you do come positive, we can initiate you in treatment. You can also visit your nearest healthcare facility if you are on leave or if you are at home at break or on holiday. You can go to your nearest healthcare facility and get tested there. If your cough persists for more than 2 weeks or more, you have to seek evaluation, you have to seek investigation. Do not self medicate. Self medication can give rise to more harm than good. So you have to make sure that you contact HCHC, visit the nearest healthcare facility, or seek any doctor's advice for investigation and evaluation. Next, please. So I am going to enumerate this once again, that TB can be 100% cured. It can be eliminated from your body if you complete the treatment. You have to complete the treatment. Midway leaving the treatment is no way to go. Get earlier tested. If you see somebody who has these symptoms, ask them to get tested, and that's how TB harega and desh jeetega.
Thank you, Dr. Kulkarni, for that highly informative and clinically insightful session. We deeply appreciate you sharing your time and expertise with us today. We will now open the floor to the audience for a brief Q&A session. Please step forward with your questions. So, sir, the first question is, can a person continue attending college or work while undergoing tuberculosis treatment?
Okay, so a person can continue to attend college or work if their contagious period is over. That is, more than 2 weeks are done. And after 2 weeks, we usually tend to ask them to do a sputum smear test once again. If 3 samples are negative, they can continue their work and their college as routine. But if they are still contagious, that means that they have symptoms such as cold, cough, then it is recommended that they should not be attending college or work during that time.
The second question is, what precautions should roommates or family members take if somebody is diagnosed with TB?
The precautions has to be taken like wearing a mask, frequently washing your hands. Also, you have to make sure that you and the patient is taking proper nutrition, properly hydrating, and if they have TB of the second type, that is extrapulmonary TB, then they get whatever the symptoms are. For example, if it is TB of brain or TB of bones, they are properly adhering to the treatment regimen.
On the similar lines, the third question is, are the symptoms of pulmonary tuberculosis and extrapulmonary tuberculosis the same?
No, actually, pulmonary tuberculosis presents as cough, unexplained weight loss, and more of a respiratory symptom, such as there can be shortness of breath as well. There can be blood in sputum. But if extrapulmonary tuberculosis is there, what does that mean? Any organ or any tissue other than lung, then whichever tissue is involved, the person will have a symptom of that particular organ system. For example, if they have tuberculosis of gut or abdomen, then they can have digestion problems, they can have loose motions. If a person has TB of brain, they can have persistent headache, they can have photophobia, they can have neck rigidity, and unexplained fever, and usually weight loss is there in all the TB diseases, may it be pulmonary or extrapulmonary.
What lifestyle and dietary measures help a person recover faster from TB?
Basically, ensuring that adequate, proper or good nutrition, protein rich nutrition with high fibers, with ample amount of carbohydrates, lesser amount of salt, lesser amount of sodium, more amount of potassium, hydrating yourself in ensuring that there is adequate water intake is usually a way to go from recovering quickly or recovering easily from the tuberculosis infection. It does not make sure that TB will go away without treatment, but it will be adjuvant to the treatment if you do follow all of this all of these things.
All right. So someone has asked the question, is extrapulmonary tuberculosis more contagious?
No, extrapulmonary tuberculosis is usually not contagious because only way of transmission of tuberculosis is air. So droplet method, which is tuberculosis of chest, is usually a way of transmission of the disease. Extrapulmonary tuberculosis, what does that mean? The particular person has contracted tuberculosis, but the infection has gone out from the lungs to another tissues. It can infect any of the tissues, but there is no chance of that tissue to spread around the disease in any way. But a person can have gut tuberculosis and can spread by fecal oral route, but it is very rare.
Okay. So does tuberculosis infection remain in the body even after it's cured?
Tuberculosis infection remains in body in dormant method if dormant way if patient has not completed the total course of the tuberculosis treatment, but if they have cured of it, or they have completed the course, there is a chance that they will not have tuberculosis again. But I will not give 100% guarantee. The two ways person can have tuberculosis again is reinfection. That means I've already told you there is a 25% global burden of tuberculosis is there in India. So TB is endemic in India. So person can get reinfected by tuberculosis. The person who has already undergone complete treatment of tuberculosis can get reinfected by tuberculosis. And there also can be a relapse if they stop the treatment midway, or they do not complete it, whatever was duration was suggested by the doctor, they do not complete it, or they do not complete the regimen, then it can remain in the body in dormant method.
The next question is, where can we get treatment for TB? Is it in all hospitals or is it only in government hospitals?
No, we can take treatment in all hospitals, but government hospitals usually provide treatment for free. If you go to corporate hospitals or private hospitals, the chances are there that the treatment will not be free for you. If you want a free treatment, you can always go to government institutes and government hospitals. Of course, you can have paid tablets or paid treatment also, and for that purpose, you can go to any hospital, but government gives you for free.
The next question is, are there any food restrictions?
Food restrictions, whatever we tell to any infected patients in any disease, do not consume high calorie or calorie rich food. Spicy, oily should not be taken. Smoking has to be avoided or quit permanently. Alcohol intake should not be done. It should not be fried food. Prefer domestic or home cooked food, which is nutritious. All of those things can be followed along with adequate water intake or hydration.
Are there any restrictions to exercise?
Initially, when person is contagious, we should not be advising the patient to do any exercise when they are in isolation. If a person has pulmonary tuberculosis, immediately they should not go to any intense exercises. For at least 4 months, they should avoid intense exercises, but do not stop with exercise totally. The lung exercises or the spirometry or the physiotherapy of chest has to go on. In that way, we can make sure that your lungs are in proper condition and remain in proper condition throughout your treatment.
All right. Thank you all for an engaging discussion. Please look at the screen and scan the QR code. This final evaluation is vital for us to measure the session's impact and educational outcomes. We will pause for 5 minutes for you to complete it. Thank you, everyone. Before we conclude, for anyone who wishes to review today's material, or for those who could not join the live broadcast, the full recording will be uploaded to the Learning Management System LMS. It will remain accessible on the portal until 30th of July 2026. As we conclude, let us carry forward the national resolve that drives this mission. TB harega, desh jeetega. Thank you once again for your active participation in the Symbiosis Health Promotive Initiative and for your unwavering commitment to a TB Mukta Bharat. Thank you, SSODL, for all your help. Have a wonderful day.